Healthcare is a vital aspect of every society as it plays a significant role in ensuring the well-being of its citizens. However, the US healthcare system has been a topic of controversy for decades, with many debating its effectiveness. The United States spends more on healthcare than any other country globally, yet it consistently ranks lower in health outcomes compared to other developed countries. In this video, we will explore the debate surrounding the effectiveness of the US healthcare system. Background: the US healthcare system is a complex structure of public and private organizations, including insurance providers, hospitals, clinics, and individual healthcare professionals. Healthcare services in the US are primarily funded through a combination of private insurance, Medicare, Medicaid, and out-of-pocket expenses. However, despite being one of the wealthiest nations globally, the US healthcare system faces many issues, such as high healthcare costs, limited access to care, and disparities in health outcomes. The evolution of healthcare policy in the US has been an ongoing process that has undergone various changes over the years. Significant laws have been passed, such as the creation of Medicare in 1965 and the Affordable Care Act in 2010. Despite these measures, the US healthcare system continues to face significant challenges that affect access and quality of care. Arguments for the effectiveness of the US healthcare system. There are several arguments in defense of the US healthcare system's effectiveness. Firstly, proponents argue that the US healthcare system provides high-quality care, with advanced medical technology and innovation. Secondly, supporters argue that private enterprise plays a crucial role in driving innovation, promoting competition, and reducing costs. Thirdly, advocates of the current system argue that the US healthcare system provides a level of choice and autonomy that is unmatched by other countries. To support these arguments, advocates point to the US healthcare system's advanced technology, world-class medical schools, and research institutions. They also point to the private sector's role in driving innovation, developing new treatments, and improving efficiency in the healthcare industry. Arguments against the effectiveness of the US healthcare system. There are several criticisms of the US healthcare system's effectiveness. Firstly, opponents argue that the high cost of healthcare in the US creates significant barriers to access, especially for low-income Americans. Secondly, critics point to the fact that the US is the only developed country without a nationalized healthcare system, which has resulted in significant disparities in health outcomes. Thirdly, opponents of the current system argue that the profit-driven nature of the US healthcare industry incentivizes providers to prioritize profits over patients. To support these criticisms, opponents point to the fact that the US spends more on healthcare than any other country globally, yet has lower life expectancy, higher infant mortality, and higher rates of chronic illness compared to other developed countries. The debate surrounding the effectiveness of the US healthcare system is complex and multifaceted. While advocates point to the quality of care and innovation provided by the US healthcare system, opponents argue that the high cost, limited access, and disparities in health outcomes outweigh these benefits. Ultimately, there is no easy solution to this issue. However, it is clear that addressing the issues facing the US healthcare system will require a comprehensive and collaborative approach involving policymakers, healthcare providers, and citizens alike. By working together to find solutions to these challenges, we can help ensure that all Americans have access to high-quality, affordable healthcare.